Susan's a single mom who works 2 jobs to support her son, Josh, in college. She grew up in a military family and followed in her father's footsteps to serve her country. Aside from being a proud mom and vet, Susan enjoys gardening and volunteering at the USO, bringing out the best in others. But recently, she's been feeling down and keeps to herself. Her friends have noticed she hasn't called. At first, Susan thought it was just empty nest syndrome after Josh left for college. But it's more than that. Most days, she thinks a lot about her past, wishing things turned out differently, and she regrets some decisions she made after her husband died. She worries what the future will hold. Susan tries to push away these negative thoughts, but can't. She feels stuck in a black hole. Josh noticed this while he was home on semester break. It reminded him of when his high school girlfriend had depression. So, Josh told his mom he was concerned. Susan dismissed it at first. But then Josh's words got to her. She realized she needed to do something to get unstuck and move forward, but she didn't know what to do. So, Josh, a computer science major, went to Dr. Google. At first, he found way too much information about treatments and resources. What could he trust? Then he came across a public education website created by experts called Treatment Works for Vets. He showed it to his mom. She was skeptical, but she liked that it focused on vets and proven treatments. One treatment stood out: acceptance and commitment therapy, or ACT. She liked that it helps people get unstuck from difficult thoughts and feelings and move forward in their lives. ACT is a talk therapy that teaches proven skills for accepting and not being controlled by negative thoughts and feelings that lead to depression. By freeing oneself of the weight of their thoughts and feelings, ACT allows people with depression to take control over their lives. ACT also helps people move forward by helping them figure out and work toward what truly matters to them, what they want their lives to be about. Studies show ACT is effective in helping both veterans and non-veterans overcome depression and lead more fulfilling lives. And it usually requires only 12 to 16 sessions. Susan wasn't much for therapy, but ACT sounded different. The idea of learning how to stop struggling with her thoughts and feelings and how to live the rest of her life in a way that really matters to her made real sense. So, she told Josh she'd give it a try. Learn more about ACT for depression and see Susan in treatment at treatmentworksforvets.org.